And amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. Our department videos will be available in the playlist. You can check it. Today we are going to see about vascular access. Vascular access is a hemodialysis patient lifeline. It makes life-saving hemodialysis treatment possible. Hemodialysis is a treatment for kidney failure that uses a machine to send the patient's blood through a filter called dialyzer, which is outside the body. The access is surgically created vein used to remove and return the blood during hemodialysis. And the blood goes to a needle for few ounces at a time, and then the blood travels through a tube that makes it to the dialyzer. Inside the dialyzer, the blood flows through thin fiber that filter out waste and extra fluid. The machine returns the filtered blood to the body through a different tube. A vascular access lets a large amount of blood which flows continuously during hemodialysis treatment to filter as much as blood possible per treatment. About a pint of blood flow through the machine every minute. A vascular access should be placed weeks or months before the first hemodialysis treatment. Two types of vascular access designed for long-term use. They are AV fistula and AV graft. A third type of vascular access is the venous catheter. Is for short-term use. AV fistula. AV fistula is a connection which is made by a vascular surgeon of artery to a vein. Arteries carry blood from the heart to the body, while veins carry blood from the body back to the heart. Vascular surgeons specialize in blood vessel surgery. The surgeon usually places AV fistula in the forearm or upper arm. AV fistula causes extra pressure and extra blood to flow into the vein, making it to grow large and strong. The larger vein provides easy, reliable access to blood vessels. Without this kind of access, regular hemodialysis session would not be possible. Untreated veins cannot withstand repeated needle insertion because they would collapse the way a straw collapses under strong suction. Healthcare providers recommend AV fistula over the other type of access because it provides good blood flow for dialysis, it lasts longer than other type of access, it less likely to get infected or cause blood clots than other type of access. Before AV fistula surgery, the surgeon may perform vessel mapping test. A vessel mapping test uses Doppler ultrasound to evaluate blood vessel than the surgeon may use to make the AV fistula. Ultrasound uses a device called transducer that bounce safe, painless sound waves of organ to create an image of the structure. A specially trained technician perform procedure in healthcare provider office, outpatient center or hospital. A radiologist, a doctor who specializes in medical imaging, interprets the image. A Doppler ultrasound shows how much and how quickly blood flows through the arteries and vein, so the surgeon can select the best blood vessels to use. Surgeon perform AV fistula surgery in an outpatient center or hospital. A vascular access procedure may require an overnight stay in the hospital. However, many patients go home afterward. A healthcare provider uses local anesthesia to numb the area where the surgeon creates the AV fistula. AV fistula frequently require 2 to 3 months to develop or mature before the patient can use it for hemodialysis. AV fistula fails to mature after surgery, the surgeon must repeat the procedure. At the start of hemodialysis session, healthcare provider insert 2 needles into vascular access. One needle carries blood from the body to dialyzer, the other carries filtered blood back to the body. To tell the needle apart, the needle that carry blood away from the body is called arterial needle. The needle that carry blood back to the body is called venous needle. The patient should know how to take care of the needle insertion area to prevent infection. If an AV fistula does not mature, AV graft is the second choice for long-lasting vascular access. AV graft. AV graft is a looped plastic tube that connects an artery to vein. Vascular surgeons perform AV graft surgery like AV fistula surgery in an outpatient center or hospital. With AV fistula surgery, the patient may need to stay overnight in the hospital although many patients can go home after the procedure. Healthcare provider use local anesthesia to numb the area when the surgeon creates AV graft. A patient can usually use AV graft 2 to 3 weeks after the surgery. AV graft is more likely than AV fistula to have problems with infection and clotting. Repeated blood clots can block the flow of blood through the graft. However, a well cared for graft can last several years. You can see the image of AV graft in forearm. Patients should set up vascular access well before starting hemodialysis, as AV fistula and AV graft both need time to mature before they are ready for use. Giving a vascular access time to mature can help to prevent the problem with narrow vein, low blood flow and blood clots. Venous catheter. A venous catheter is a tube inserted into a vein in the neck, chest or leg near the groin, usually only for short-term hemodialysis. The tube splits in two after the tube exits the body. The two tubes have caps designed to connect to the line that carry blood to the dialyzer and the line that carry blood from the dialyzer back to the body. A person must close the clamps on each line when connecting and disconnecting catheters from the tubes. If kidney disease has progressed quickly, a patient may not have time for placement of AV fistula or AV graft before starting hemodialysis treatment. A nephrologist, a doctor who specializes in kidney problem, or interventional radiologist, a doctor who use medicinal imaging equipment to perform the venous catheter placement procedure in hospital or outpatient center. The patient receives local anesthesia and sedation to stay calm and relaxed during the procedure. Venous catheters are not ideal for long-term use. With venous catheter, a patient may develop blood clot, infection or scarred vein, causing the vein to narrow. If a patient needs to start hemodialysis right away, venous catheter will work for several weeks or months until a surgeon can perform long-term access surgery and the AV fistula and AV graft has time to mature. If fistula or graft surgery is unsuccessful, then a patient will need a long-term venous catheter access. When a patient needs venous catheter for more than 3 weeks, the surgeon will tunnel the catheter under the skin rather than insert it directly into a vein. A tunnel catheter is more comfortable and has fewer problems. Even tunnel catheter may become infected. You can see the tunneled venous catheter. The complications of venous access are thrombosis, access infection. A patient can care for and protect vascular access by ensuring that healthcare providers check the access for signs of infection or problem with blood flow before each hemodialysis treatment, even if the patient is inserting the needles. Keeping the access clean at all time, using the access site only for dialysis, being careful not to bump or cut the access, checking the thrill in the access every day. The thrill is the rhythmic vibration a person can feel over the vascular access. Watching for and reporting signs of infection including redness, tenderness or pus, not wearing jewelry or tight clothes over the access site, not sleeping with the access arm under the head or body, not lifting heavy objects or putting pressure on the access arm. Thank you.